Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. And we have Dr. Yaffe here today, so I'll turn it over to her for some brief remarks.
Thanks very much. Good afternoon, everyone. I recognize that today was a big day across much of Ontario. After months of being out of the classroom, it was back to school for many of our students, teachers, and other staff. I know it was a nerve-wracking day for a lot of people, including the parents. I do sincerely hope that if today was your first day of school, whether you're a student or a teacher, that it went well and that you're feeling positive about the upcoming school year. I know that the number of daily new cases in Ontario over the last 2 weeks, and especially over the last few days, has been a cause of some concern. To see the numbers increase as students are returning to class is certainly something that we are watching very closely. Yesterday, we reported an increase of 190 new cases, and today, 185. As has been the recent trend, the new cases are primarily concentrated in Peel, Toronto, and Ottawa. The good news remains that today, 29 of the 34 health units are reporting 5 or less cases, and 18 of them are reporting no new cases at all. Of the cases being reported recently, the vast majority have been in those under the age of 60. And in fact, today, 62% are under the age of 40. What we have observed is that the increase in new cases is in part attributable to a number of outbreaks. A cluster in a church in Toronto has resulted in at least 15 cases recorded by Toronto Public Health, with additional cases still under investigation in other health units. A wedding in York Region has resulted in at least 23 cases, with some cases residing in different public health units. And smaller outbreaks have been reported at some workplaces across the province, most with fewer than 5 cases. There have also already been some school-related cases reported by several public health units. With school only just returning, these cases were not acquired in the schools themselves, but rather were acquired in the community, and the people then went into school. As we have said before, continuous efforts from the community to practice preventive public health measures and keep the number of COVID-19 cases low is increasingly and incredibly important. One of the most important things we can do for all our own health and safety and the health and safety of those around us is to commit to those basic public health measures that we have been speaking about for months. Now more than ever, as our children and teachers return to the classroom, and with the fall influenza season approaching, we must recommit as a collective to taking care of ourselves and each other, as if we are to keep our cases low and our outbreaks minimal. None of us wants to return to the restrictive measures that were imposed in the spring. This means that we all need to continue to wear a mask when required or when you cannot maintain your physical distance. Stay home when you're sick. Stay 2 meters or 6 feet apart from those outside your social circle, and wash your hands regularly or use an alcohol-based hand sanitizer. The school-related cases also demonstrate the importance of screening. Parents and guardians must screen their child or children for symptoms of COVID-19 before school each day. And it will be important not just for students, but also for staff to stay home if you're not feeling well. Once in the classroom environment, many preventative measures are in place, adding even further layers of protection against the possible transmission of COVID-19. These include the use of masks, adopting schedules and student flow, maintaining vigilance with hand hygiene, and following distancing practices. It is all of these measures and layers of protection that will keep our students and staff as safe as possible. When there is a case or cases of COVID-19 in a school, the local public health unit is ready to investigate and manage them quickly and efficiently, just as they have done in recent days. Our health units have been working very closely with the schools and communicating with any contacts of the cases to provide clear direction on what steps need to be taken to minimize further transmission. We do know this is a challenging time, and feeling anxious and nervous is to be expected, but every one of us doing our part will support a safer return to school. Thank you. Now we can open to questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Oh, excuse me. Hello, doctor.
Hello.
I wondered about the limits that we have on 50 people indoors and 100 people outdoors. From what the Premier was saying today, people seem to be ignoring the fact or the requirement that within those numbers you have to be physically distancing properly. And I've even heard from a friend who called enforcement about a party in his neighborhood in East York and was told that as long as it was under 100 people, it was fine. But, you know, the backyards are tiny there. So clearly there's some kind of a disconnect here for people and even for enforcement.
Well, you're right that the limits of 50 indoors and 100 outdoors definitely include the requirement for social distancing. That is 2 meters. Unless you can't avoid it, then you have to wear a mask. And of course, unless the person is within your social circle of 10 people. And I do think, yes, people are perhaps not as clear as they need to be, or getting tired of the whole thing, which can be understandable at this point, but it is just so important to remain vigilant. We know we had an outbreak associated with a wedding, an outbreak associated with a church. We've seen pictures in the media of crowds, and, you know, it's very easy to become complacent. But we are all in this together. The virus is out there, and we are seeing the numbers creeping up. We don't want to get another wave. We don't want to get serious cases again and outbreaks in long-term care and deaths. So, you know, really we have to keep the message over and over again that, yes, you can have up to 50 people, but you need to keep a socially distance from them.
Follow-up?
Yeah, I wanted to get into long-term care. So, as you mentioned, most of the new cases are in people under 60, and I noticed very few new cases in long-term care. What's your expectation for if the numbers keep climbing as they have been, you know, doubling in a month, less than a month? What can we expect in long-term care in this fall? Do you think that the proper protections are in place to limit it? And do long-term care homes have enough staff now after all the attrition they had to actually be able to handle an increased incidence of COVID-19 without having to call in military medical teams or bring in hospital teams?
Well, I mean, the residents of long-term care homes are generally very vulnerable. We've seen that, and the staff also can be at risk if there isn't the proper PPE and infection prevention and control. So we've been working very closely with the Ministry of Long-Term Care and continue to work with them. Even now that we're starting to see a small increase in cases, not in that age group, not in that population. I know that the long-term care facilities and retirement homes are getting the information from the Ministry of Health to recheck and make sure their infection prevention and control is good, look at their staffing levels, and if there's any issue to contact Ontario Health or the ministry. I know they've just recently loosened the visiting conditions, and we certainly don't want to go back on that. But you know, the measures that are in place right now are sufficient. We haven't seen an increase in outbreaks in that group, but it's definitely a group we're watching. And at the first sign of any problem, we will have to do some more measures. But again, we're working very closely with the Ministry of Long-Term Care, which is responsible for that sector.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Good afternoon. The announcement today was that Ontario won't be loosening any further restrictions, but I'm wondering what you could say at all today about if measures need to be rolled back. Seeing people on social media talking about reverting to a kind of a stage two existence again, and I'm wondering. Obviously, we moved through the immediate, initial lockdown, stage 1, stage 2, in an order that we did because we were learning things as we went. Are there elements of stage 2 that we would not repeat? I noticed that I haven't heard a lot about outbreaks at a gym, for example. Might gyms be allowed to stay open even if we have to dial back other measures? I'm just wondering if there's anything you could say at all about that today.
Well, you're correct that we have put a pause on considering further opening of facilities that have not been opened, pending 2 incubation periods, 28 days after school reopening. We have to see what happens. We're very closely monitoring. There is no clear plan right now to go back to stage 2. That doesn't mean we wouldn't, and we might. Right now, the main numbers, the main issues are in 3 health units, in Peel, the northwest part of Toronto, and in Ottawa. So we are working very closely, particularly with those health units, to see where the infection is, where is the transmission, how can we make sure if they need any assistance or support, and is there anything that they would advise in terms of controlling transmission in those settings. There is no specific plan to go back to stage 2. It might be parts of it. It, again, will depend on where the infections are and how well, if they cannot be controlled, we may have to cut back in certain areas.
Follow up?
The Premier had mentioned a case in Muskoka of 170 people at a camp. I was just watching the local medical officer of health's briefing on this. He says that, in fact, there was no new infection traced to that event. I'm just wondering if you can confirm that and if how serious an event like that is in terms of pandemic control.
The local medical officer of health was correct. There were no new cases identified in that camp. However, it was a serious issue because a number of young adults had come across the border from, I believe, from the United States and gone to quarantine at that camp. In stage 3, we are not permitting overnight camps, period. Plus, they were supposed to go into individual quarantine. So we were fortunate that the OPP identified they were quarantining at the same address, which piqued their concern. They went over, and it turns out they had their families there with them. So this wasn't really a proper quarantine, obviously, but the quarantine period for those individuals has passed, and they have been ordered to go back to their homes, and they will continue quarantine for the required period. But luckily, no cases have been identified.
Next question.
Your next question comes from Allison Martell with Reuters. Please go ahead.
Thank you. With classes resuming, is there a plan to increase testing capacity in Ontario to accommodate any symptomatic students who need COVID tests to return to school?
I believe there is a plan to increase the testing capacity in Ontario. That doesn't mean that more people need to be tested. It means that we need to have that capacity if required. There also are plans underway around perhaps even testing some grades or some students who are asymptomatic. This is under discussion right now. But certainly, if somebody is symptomatic, they need to be tested. And right now we have good access to testing across the province, and that needs to continue.
Follow up?
Are you working from any particular assumption about what proportion of kids are going to develop one on the very long list of symptoms in a given week and potentially seek testing in the next few weeks?
I don't have a particular number. I do know I've learned from the Ministry of Education that in normal times, as in before the pandemic, they had around a 9 to 10% absenteeism rate on a regular day for a variety of reasons, some health reasons, some non-health reasons. So there will be a lot more interest and attention now paid to absenteeism, monitoring, and hopefully nobody will come to school ill, but we will find out if they do have symptoms, they will be referred for testing and told to self-isolate until then. I can't estimate a number. We'll have to see how it goes.
Next question.
Your next question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Doctor.
Hi.
I'm wondering, in much the same way that some areas, some regions were held back from moving to stage 3, could we see individual regions move back to stage 2? And what would be the criteria for that?
I think it is certainly possible that a change in stage could happen by region. If there are many health units, as I said earlier, that have had no cases or very, very few cases, whereas some have had a significant number of cases and the numbers are increasing. How that decision would be made would be through the public health measures table, which has some medical officers of health and some technical experts on it that report to the chief medical officer of health, who then makes recommendations to the government. So they look at a number of factors: the trends, the case rate per population, what percentage of cases there's no link, you can make no link with an outbreak. So there's a number of factors that go into that decision.
Follow up?
Yeah, and today we heard from Minister Elliott that we're not going to have any further openings for the next month. Were there things being considered, were things on the table that we're going to open up that will now not open, and what are those?
Yes, there were a number of things that were under consideration, so those decisions now are deferred for at least 28 days. I don't have the complete list, but the ones I'm aware of were increasing the number of people who could play in a sports league, both inside and outside, increasing the number of spectators at motorsports, steam rooms, saunas. There were some increasing requests around casinos. Those are some of the examples I'm aware of.
Next question, and this will be the last question.
Your final question comes from Richard Southern with 680 News. Please go ahead.
Hi, Doctor. Good afternoon. I understand that things have been put on pause here for 4 weeks, but I wanted to ask you about amusement parks. We know we have Wonderland up in Vaughan. They had planned to do events throughout the fall and even into Christmas, and they have, a huge park there, space for distancing. They put a plan forward to the government and the health table. Why has nothing been moved on the possible reopening of amusement parks like Wonderland, aside from what was announced today with the pause?
I can't actually speak to that specific thing. I do know that they have been on pause. I think I'm just, musing here that it may be that it's very hard to maintain social distancing in that kind of situation with the crowds. But again, I can't speak to that specific instance.
Follow up, and this is the last question.
Doctor, I'm wondering, too, what you thought about casinos. We heard from the Great Canadian Gaming Company today. They're opening 11 casinos throughout the province. They are adhering to the 50-person minimum, but, a lot of people reaching out to me online about, hey, there's a lot of touch surfaces in there. What are your thoughts on casinos reopening, Doctor?
I believe they have been permitted to open with a maximum of 50 people per room, although some have said they cannot do that. So if they can, and they can meet all the conditions the public health has put on them, including extra cleaning and distancing and so on, I think that's fine. Obviously, we'll have to see how it goes. I think it's always a balance between allowing further expansion of activities versus controlling activities to reduce disease, and the unintended consequences, of course, of restricting activities in terms of the economy and social and health well-being versus controlling disease. So it's always a balancing act of risk and benefit.
Thanks, everyone.